we still have very large numbers in the ICU. We've seen the largest numbers over the last 2 weeks than we've seen since prior to the start of the pandemic. We have very high rates of ventilated patients. And unfortunately with that we have high mortality. I think research essentially shows about 25 to 30% of people that end up in the ICU with COVID-19 do not survive. And with the volumes of patients that we're seeing, it's very, those are big numbers for our community and our families that are going through a tremendous amount of anxiety. They can't be here with their family members. We're using video to communicate with them so that they can at least see what's going on, but I think the trauma that our community is experiencing, both our staff as well as the family members of our patients, is going to be with us for a long time. I think it's going to be a lot for people to get over, that grief that they're not going to be able to kind of work through. You know, guilt and, you know, what could I have done differently and could we have prevented this? And I think one of the things that we try very hard to do is certainly not blame people. People are human, and you know, nobody wants to get COVID or transmit COVID, and I think really now is not the time to figure out like how you know, why did this happen? We just have to figure out how can we stop this and really pull together as a community and get through this and really pull together and stop pointing fingers at people and blaming people for what it is that they're doing, and just figure out how we can get through this pandemic. We've got probably a long few months ahead of us until the vaccine is really broadly available. And until we get 70 to 80% of the population vaccinated and get that herd immunity that we've been talking about, we're probably going to still see community transmission. So we're all very hopeful that the vaccine will start to get us out on the other side of this so we can get back to some normalcy, hopefully in the fall this year. And then we can start moving on, because if the community is tired of being in lockdown, I can assure you that the healthcare workers are very much more tired of it.